All right, we are back, another edition, and it seems as if, at least on the surface, where you start to see numbers go continuing to rise, positive cases, and again on the surface, and this is the purpose of our conversations each week, is to try and get deeper and behind the numbers and the data and determine what's going on. But on the surface, it looks like things have gone from bad to, if not worse, somewhere in between bad to worse.
Yeah, I think you're right. I think that things have not by any means improved. If anything, they've deteriorated because you could see the number of states where infections are rising, but also pressure on the healthcare system is rising at the same time. So, although the curve for deaths from COVID-19 have possibly flattened and even gone down in major areas, um, it's no time to take a sigh of relief and say, okay, this thing is over. It's by no means over. And right now, probably the deaths that we saw early on, which were mostly people with advanced age, is somewhat mitigated because I think overall, that population is much more careful than what we're seeing in terms of the younger population, which is becoming clearly impatient with these restrictions and are congregating in large numbers, no social distancing, and as you could see, very few are wearing masks. So the risk here is clearly to those, even though you're young, some of those people may have comorbidities which may result in either a severe infection with significant impact on their quality of life or death. However, at the same time, if they come from a home where there are elderly people and they bring infection into that house, then again, the risks are still high.
So essentially what we're dealing with now, and it's something that we've seen over the past 2, maybe 3 weeks, at least 2 shows that we've done, is the average age, and you referenced this by the death rate dropping, but the average age of infection is clearly dropping precipitously to bring it down anywhere from 12 to 13 years, depending on where we look at different states. How much of this will be different than that first wave or the first part of this same wave, knowing that death rates will be down? Do you think that there's going to be the same call for, at least medically speaking, people to be back inside? Or because we're seeing a higher infection rate, but those being younger people who aren't dying, there won't be as much of a push to kind of return to what we were doing by quarantining and staying away inside?
These are very good thoughts and questions. The point again is that we really don't know. Just because today or yesterday the death rates were low does not mean that they're going to stay low. So I think that's first. Second, if they continue to rise, we may see some states take an initiative in terms of shutting down again. That's happened if you look at Europe. Spain and Switzerland and others have now started to shut down areas where they think that infections are rising again. So we're, as a nation, I don't think that overall, looking at the stats of this week, we're behaving very responsibly. We understand that people are frustrated. We understand the perils of the economy. We understand all of those issues. But again, when you're dealing with a pandemic who's still active, measures will have to be drastic, and measures that are needed to control it are, I think, being ignored by a significant number of our population. In other countries, there is a capability of making a decision and following it through. Here, there's a lot of talk about rights of individuals, including, unfortunately, our Surgeon General. Instead of which last week, if I can sort of not fully quote, but stating that wearing a mask is up for your personal decision or freedom of choice. In fact, coming from the Surgeon General, I think that there should have been a little more emphatic use of, again, anything that we could do to prevent spread. Now, it doesn't mean that people will do it, but to leave things as a choice versus as mandated, I think is probably not the best way to do things.
Nothing has changed. You keep distance from people, you wear a mask, you wash your hands vigilantly, and if you feel the need to wear gloves, you wear gloves, and make sure you still wash your hands after you take your gloves off, right? I mean, nothing
Yeah.
has truly changed from our first conversation on how to not beat this thing, but at least stay as safe as possible throughout it.
No, no question. Nothing has changed. It is the same bug, and there's some thought that maybe this bug has mutated to become a little more infectious, meaning that the transmission is much easier for the bug now than it was. I'm not really sure that we have enough data to say that. We're suspicious because there's a large number of people who are testing positive, meaning that the spread is wider, but maybe because of the age of the individuals and their underlying health, we're not seeing the same rise of both morbidity and mortality. Now, that being said, I think we have to be cautious because just because we're not seeing, as I mentioned already, mortality going up, it doesn't mean that tomorrow it will not, it will stay the same. I think if there's still, we have to be very cautious about that.
Yes, but to your point, even if you look at the definitions from, and I just want to make sure that I have this here to pull up specifically, but it seems as if there are lengthier definitions to what can constitute a positive test than simply testing positive for COVID-19. And again, I'm reading this right from the CDC. So and again, this is why I go to you, because a lot of stuff out there seems to go back and forth. You just mentioned the Surgeon General being a little wishy-washy on the mask in the first place. A positive test results show you may have antibodies from an infection with the virus that causes COVID-19. However, there's a chance a positive result means that you have antibodies from an infection with a virus from the same family of viruses called coronaviruses, such as the one that causes the common cold. So again, there are 5 or 6 different definitions of what a positive and then a negative test can be. And I think what's happened is it's been simplified for better or worse, in worst case, by people in the media and beyond who say, well, a positive test always equals worst case scenario, COVID-19 equals hospital bed, which is not necessarily the case.
Right. So I think what you need to do is to separate out the two major portions of the testing for COVID-19. One, which is what you just mentioned, which is antibody testing, which in the past we would think would be a signal of whether you have antibodies to the virus and therefore you had been infected and now show some immunity. On the other hand, the other testing which we do, which is the one that people are standing in lines all over the place, is to see whether you have the virus in your system. And having the virus in the system will most likely, that's a positive test. Again, not perfect, but pretty close to defining if you are currently shedding virus or have the disease. The other test I just mentioned, which is the antibody test, that is one where it has a lower, what we call in medicine, sensitivity and specificity, meaning that the number of false positives and false negatives are still pretty high in that range. And there's also the issue of antibodies which are purely derived from COVID-19, which may not have a longevity within the body, which is something that we're looking at right now, is to see how long, and it varies from one individual to another in terms of how long those antibodies stay in your circulation and actually active. So there are 2 buckets. One bucket is trying to define whether you were infected and have immunity against it, which is not a great test, but it's still a test. And that's what you were reading from the CDC. The other test is the COVID-19 in terms of trying to determine whether you have virus.
Okay, I do want to get your thoughts on where we are, and it might be too early, but in my world, for example, we have a lot of athletes who are determining whether or not it's safe to play whatever sport it is to return. And they have all different reasons. Some because they live with people at high risk, others because they have a baby on the way. But there are a large group of athletes, professional athletes, that are young, mid to high 20s, in some cases, 23, 24 years old, that don't want to expose themselves to this because of the long-term damage. Are we at a point right now where there is enough data to look at some of the long-term ramifications and damage that this can cause to even asymptomatic people?
Right. So we don't know about asymptomatic people because it's very hard to follow people who have not been admitted to the hospital. However, those who have been admitted to the hospital have a flare of disease, which is, again, significant enough to be in the hospital and also significant enough to be in an intensive care unit, that we know that there are sequelae. And the sequelae can, again, harm anything from your lungs to your heart and maybe possibly even your brain. And I'm sure individuals have survived the severe disease who are now being rehabilitated because of they're considerably weak and have a lot of cognitive problems.
So would your advice, or I should say, what would be the proper approach right now to a younger person? Obviously nobody wants to get this, right? But we still don't have enough data to say if you get it, you're low symptomatic. At best, you maybe one or two symptoms for a day or so. You have it, you move on. To say that you would be in the clear for any type of long-term respiratory, meaning can this thing come back and hurt you in different ways without it specifically being COVID-19? Can you have it 2 days, go through it with a cold, a cough, something similar to that? You get tested after 10 days of quarantine, you come back negative, but 2 years down the line, you're still dealing with a type of respiratory issue that's not COVID-19.
Yeah, we don't. To be perfectly honest with the question you have, which is a good one, I don't know that we have enough information to make any kind of statement on that. We also can't predict who is going to be infected by the virus, such as any ball player, as an example. And so we cannot predict whether that individual is going to end up with a fairly mild, cold or flu and recover and do just fine versus somebody having severe symptoms and needing to be admitted to the hospital and with a sequela and a high risk of death. So if we were able to predict that, we could probably assign some kind of a risk level to each one of those individuals and say, you know what, your risk is so low, the odds are that you'll do just fine going through this. Or we could say your risks are so high, we recommend you don't participate in this particular activity. But we don't have that information to be able to do that right now. So a lot of speculation right now, and it is to some extent the individual trying to figure out what's best for them, and on that level, we can't really make a recommendation.
All right, last one, and we'll chat again next week, see if we have any more developments, especially hopefully some positive ones. Has there been any example, because this might be some small, but still some saving grace to how many young people continue to be exposed and test positive and bring the average age of infection down? Has there been any example around the world, if it's Sweden or anywhere else, where younger herd immunity has actually worked or at the very least mitigated?
So I don't think again, that's a very good question. And, again, shows your understanding of what normally would happen under the circumstances. But we have not yet have enough information about the younger population and herd immunity. And the reason I say we don't have enough is because as we're testing, we're seeing more and more people coming back with positive test results for the virus, not necessarily for the antibody portion of it. And as such, a lot of people are still getting infected. So does that mean that the fact that they had an infection and now they're sort of not necessarily immune, but have a resistance to being infected again, is the supposition of the herd immunity? But we don't know that for a fact because there are reports of individuals who had COVID-19, recovered, and then got reinfected. That was early data, mostly from China, mostly Wuhan, but I'm not really sure what the data is right now in terms of establishment of herd immunity. If herd immunity is part of the scenario with this pandemic, what we're going to see is we're going to start seeing a drop in the number of people being infected after, period of time, maybe a few weeks or months.
All right. We'll chat again next week. Thank